In Chapter 7 of Prevent and Reverse Heart Disease, what did you mean by, why didn't anyone tell me?
Sadly today, with all due respect to my cardiovascular colleagues, when they go through medical school and when they go through their postgraduate cardiology training, they really don't spend much time, if any, about nutrition. As a matter of fact, when I find sometimes that I'm presenting my presentation on reversing heart disease and I talk all about the endothelial cells and nitric oxide, they're a little bit bewildered. That's not something they hear much about at all. They never communicate it to their patients. This is the kind of story that I frequently hear from a patient. First of all the patients that I see are self-referred. They're not referred by their doctors. They've gotten curious about their disease. They've gone to the internet, they've looked it up, and they find out about disease reversal, and I guess my name is one of those that comes up. They come, they see us, they hear all about this, and they really go after it. And they, 2 or 3 months later, when they're back home, they see their doctor. And the doctor says, "Oh, your blood pressure is coming down. We're going to have to reduce your blood pressure medication. You've lost some weight, your diabetes is going away. We're going to have to reduce your diabetic medication. Oh my goodness, your cholesterol is really starting to fall. We're going to have to decrease your cholesterol-lowering medication." But that's good. It's being done in the hands of an expert who recognizes that there's less need for these medications. And then the patient is being congratulated by their doctor at home for what they've done, and the patient says to the doctor, why did I have to go to Cleveland to learn this? And see Dr. Esselstyn? Why didn't you share this with me? And he said, well, I gave it up. I tried it a few times, but nobody would seem to follow it. I think we've got some insight into that. If you're going to make a lifestyle change, you've really got to show a patient respect. And by that I mean you've got really to show them your time. If you think as a physician that in a 12 or 15-minute office visit that you're going to get a patient to make a lifestyle change, you've been smoking something. That ain't going to happen. But when you do take the time, well, for instance, right now, we do this in groups of 12 or 14 patients on a single day. It's a 6-hour seminar. And in that 6-hour seminar, people are going to get information about how they have created their disease and precisely how we're going to make them empowered as the locus of control to halt and reverse their disease. Yeah. And at the same time, everybody gets a hefty notebook. And in that notebook is a copy of every PowerPoint slide that I used, several of our scientific articles, a 44-page handout with many additional recipes that add to the 240 which are in the 2 books that we're going to give them. They also have an hour-and-a-quarter presentation from a marvelous woman with 30 years experience acquiring and preparing plant-based foods, dealing with reading ingredients, travel and restaurants. And then everybody at the seminar is going to get a hefty notebook that has a copy of every one of my PowerPoint slides as well, I mentioned. Then everybody is going to hear now from 2 or 3 local or regional participants who previously had a successful experience, who share their story with those in attendance, so those in attendance can say to themselves, listen, if he or she can do this, I can do this. And then we have a wonderful plant-based luncheon, and then stay in touch as necessary with email or phone call. And yet, the way it's established now, I never try to drive a wedge between the doctor at home and their patient. Because as I mentioned, we want those doctors to monitor their medication and reduce it as appropriately. Yeah.